Hi, my name is Trina Brown, and this is our presentation. We're going to be presenting sickle cell disease. A little information about sickle cell. Sickle cell is an inherited blood disorder that causes the red blood cell to be S-shaped. Hemoglobin is an oxygen-carrying component in a red blood cell. In order to effectively perfuse the body and organs with oxygen, the ideal shape of the cell should be round. The S-shaped cells lack adequate oxygen and also is not as flexible to move freely through small and large vessels like a normal red blood cell. The sickle cell tends to stick to the walls of the vessels, causing a blockage and pain, also called pain crisis. TM is our patient, and he's a 19-year-old male with a medical history of sickle cell anemia. He resides with his mother and two sisters in an apartment. He attends a community college, and he is currently unemployed. TM is compliant with his medical treatment of sickle cell, which includes taking prescribed medications and appearing to his scheduled appointments. TM averages 2 to 3 crises a year. Treatment demands. Treatment at home consists of taking prescribed medications. His medications are hydroxyurea, a medication that lower the chances of having a pain crisis and different diseases that can cause pain, like acute chest syndrome. He also takes folic acid. That helps him stimulate red blood cells, and take methadone for pain management. Drinking plenty of fluids also help with lowering the chances of pain crisis, and wearing appropriate clothing for the weather, and having a balanced diet. Going to the doctor regularly for a blood transfusion may be required because the red blood cell's life cycle is shorter than a normal red blood cycle. When you have sickle cell anemia, the S-shaped cells tend to die in 10 to 20 days, whereas a normal red blood cell blood cycle is usually 120 days. So a lot of times these patients are a little more anemic more often. Treatment at the hospital consists of hydration with normal saline, pain management with intravenous narcotics, a lot of times morphine or Dilaudid, blood transfusions, and comfort measures like oxygen and warm packs to the areas that has pain. This disease process is crucial to those who are affected. The disease is very debilitating to those in a crisis. During a pain crisis, the patient may not be able to meet their activity of daily livings, and will require assistance from family and hospital staff. Depending on different individuals, management of the disease, some patients may be eligible for state disability because of their inability to work and how frequent they are having a pain crisis. That concludes my section of the presentation.
So for discharge planning needs, this is a patient that is well versed in these episodes. He has been dealing with this for many, many years now. Usually people are diagnosed in their toddlerhood, and now he's 19. So we need to take that into consideration that this is not his first hospitalization. And then that can help us to further assess his needs and create those discharge plans. So a huge part of discharge planning is the teaching that we provide. So a lot of times the best way to do that is with brochures and pamphlets and pictures, because people are usually more interested in visual things like that. So like I said before, this is not his first hospitalization, so we need to assess his understanding. It's probably safe to assume that he knows the basic symptoms of the crisis and the causes of it, but we should reiterate this. So some of the possible causes, and I actually listed them in the speaker notes below, but I'll go over them. Consumption of alcohol. This is interesting to know with the age of the patient, since he's 19 and not 21 yet. He may not want to talk about drinking alcohol because he's underage. So just creating that trusting relationship with him is important as a nurse. Smoking can be a possible cause. Dehydration, stress, infection of any kind, so a cold or a virus, strep throat, anything like that. And then stress on the body from like swimming in cold water or cold temperatures. And then also, since this patient is on a new pain management plan, it's important to talk about the side effects of medication. Since he's on morphine and gabapentin now, those are narcotics, so, or at least the morphine is a narcotic, so we need to talk about bowel hygiene and the importance of that. And then also some alternative methods to pain management, such as massage, heat therapy, a warm bath, stuff like that. So there's, I looked it up actually in San Diego. There's a lot of different support groups for sickle cell anemia. And one of them is the American Sickle Cell Anemia Association. And in the speaker notes below, I posted their website and their contact number. This is something nice to give to your patients if they're, it's always better to have someone that totally understands what you're going through. Another source or support group is the Sickle Cell Disease Association of America and the San Diego chapter. I have the address, the phone number, and then the email again in that. And there's a quote from there that I really, really like. It says, "It's important for you to have a positive attitude, create a supportive environment, and develop coping skills to help you deal with your disease. Strong family relationships and close personal friends can be helpful. A support group might help you cope with your disease." And so I think that's really true. A support group is nice because it's people that understand what you're going through and have the same maybe issues that you're facing. Home care, the patient might go home with follow-up from an RN, physical therapy, occupational therapy, if it's affected his functional status in any way. And then maybe discussing wearing a medical alert bracelet, which is important for anyone that has a chronic disease. As for placement, case management helps us a lot with this. And really, I think the basics of it is what is best for the patient's health. Currently, he's living with his mother and two sisters, and that is a great situation because he's around people that know him, that know to his disease. Since he is 19, going to community college, maybe there's a time that he wants to move out and live with a roommate or go to college. It's important to discuss this as he makes that decision and talk about the importance of having someone with him. So if he does have these crises again or a crisis event, that he can have someone to help him. And then also discussing, a lot of colleges have on-campus health services, so allowing him to have resources for that, and then discussing that is a good option as well for him.
Okay, now for this patient, at the nursing case management patient strategy level, the first thing we would want to do would be to inform the patient about the purpose of CBC, ABGs, and pulmonary function tests and why he would need it because of his sickle cell anemia and possible sickle cell crises. And we would also want to continue to promote and encourage periods of activity and rest, because you want to improve circulation and make sure that the patient does not stay fully bedbound, whether in a crisis or not. So even though the patient may say he feels tired with activity, you would still want to encourage him to do as much as he can and alternate between periods of activity and rest. You would also want to promote and inform the patient of the importance of maintaining an adequate fluid intake, a minimum of 2 to 3 liters a day. This will improve blood viscosity and decrease the likelihood of future sickle cell crises. And you would also want to stress the importance of relaxation techniques and proper stress management, because high stress levels can increase the odds of a sickle cell crisis. And the main purpose of all those above strategies would be to help the patient maintain health, prevent or lessen the frequency of sickle cell crises, and promote recovery. Now, for the interventions at the patient level, we would want to teach the patient how to monitor his vital signs, such as his blood pressure, his pulse, and respirations, in order to recognize any changes that can indicate an impending sickle cell crisis, and also to get a baseline of what his normal vital signs are. That way we can also help identify an oncoming crisis and take measures to prevent that. We would want to inform the patient to report any changes in regards to pain, such as a sudden change in the character of pain, or experiencing new pain, such as sudden bone pain, which was not present before, and can also indicate an impending sickle cell crisis. And we would want, for this particular patient, we would want to teach the importance of repositioning as often as possible in order to increase tissue perfusion. And one important thing about this patient is that he is currently a full-time student, and depending on the classes, you may often be sitting for 2 to 3 hours straight, so it would be important to encourage the patient to take advantage of any rest periods or ability to step out, walk around a bit between classes, and to increase perfusion and prevent any sickle cell crises. We would also want to review what the client's typical diet is and reinforce the importance of including green leafy vegetables such as spinach and broccoli, and some citrus fruits such as oranges, lemon into the diet, as well as the use of any supplementary vitamins, all of which can help decrease the demands placed on the bone marrow, which can improve the production of red blood cells and prevent.
Hi, this is Naida. I'm doing slides 8 and 9. Slides 8, interventions for the system level strategy. We need to educate the patient on the signs and symptoms of infection, worsening anemia, and organ failure before going home. We need to encourage the patient and family members to join the support groups such as the American Sickle Cell Anemia Association. We need to coordinate follow-up care to his primary doctor or hematologist. And depending on the insurance, we may do a home care follow-up for this patient. Slide 9, utilization review. Based on the concurrent review, this patient is qualified for hospital admission due to the history of sickle cell anemia since age 11. He has unrelieved severe chest pain, which requires him pain management, has a flu-like symptoms when presented in ED. He has hemoglobin of 8.1, which requires him for blood transfusion and IV fluids hydration. This patient has only an average of 2 to 3 crises per year, which is pretty good, and he has been compliant with his medication regimen. Based on the ICD criteria, he has a blood disorder with acute sudden onset and will be ready for discharge once the pain has subsided and no evidence of infection. Thank you for listening.
Hi, my name is Jonah San Diego, and I will be talking to you about slides number 10 and 11. So for the quality and safety issue, make sure that the patient will be discharged in timely manner. There will be no complications or delay of care during patient stay. Patient's hospital stay is sufficient for his symptoms to be resolved. The patient's labs such as H&H or hemoglobin hematocrit, must be within normal limits, fever has been resolved, patient has been hydrated, and must be in stable condition prior to discharge. The patient's prescriptions must be filled upon discharge to have sufficient supply. Family must also have physician's contact numbers, aware of the nearest hospitals when away, just in case of a sickle cell crisis episodes occur. For the nurse case management effectiveness at patient level, patient and family are able to manage and control pain at home. Other non-pharmacologic techniques are encouraged as well, such as heat management, breathing techniques, and relaxation. He will continue to adhere with prescribed medications such as hydroxyurea, antibiotics, and pain medications. He will know symptoms when he needs to be brought back to the hospital. He will continue to eat healthy, drink lots of fluids, avoid extreme weather, and continue taking folic acid supplements. He will continue to follow with his appointments.
Hi, everybody. My name is Michelle. I'm going to talk a little bit about the nursing case management effectiveness at the systems level. The patient and family have been actively participating in a local community support group for sickle cell since discharge, and they've been attending this community support group for 6 months. The local support group that gives the patient and the family some support that they need outside of the hospital that will help them better manage their symptoms of sickle cell. Also, the patient has been able to make all scheduled follow-up visits. Patient has been crisis-free for 6 months, and he is able to manage his symptoms at home. By following up with his physicians, this opens the lines of communication with the physicians, which will thus decrease the amount of ER visits for sickle cell crisis. A visiting home health nurse has been following the patient after discharge, re-educating the patient and family on medication management to decrease sickle cell crisis. This has helped decrease the patient's amount of ER and hospital visits for sickle cell crisis. The home health nurse has been able to closely follow with the patient outside of the hospital to answer any questions, help them manage medications, infection prevention, as well as anemia. By doing all three of these, the patient has been able to build confidence in his understanding of the sickle cell, which has allowed him to live a better, happier, healthier life. Thank you. Here's our references. I hope you've enjoyed this. Thank you.